Good evening. Welcome to the first episode of our program Well Heard. I'm Donia Osama. I will be with you every Thursday. Our program will be discussing different psychological issues and how people suffer from them around the world. Each episode will be presenting different psychological illness, for example, depression, eating disorder, schizophrenia, and others. Today's episode is a very special one and about a very crucial topic. We will be talking about the post-traumatic stress disorder, or the PTSD. It's a psychiatric disorder in which the individuals suffer from who have encountered or seen a traumatic or unusual event. For instance, an accident, a terrorist act, threatened with death, sexual violence, or serious injury. People with PTSD may remember the occasion through flashbacks or bad dreams. They may feel pity or outrage, and they also may feel isolated or repelled from others. And people with PTSD may pass through situations or circumstances where they might remember the traumatic event. We will have Doctor who will be talking about the post-traumatic stress disorder, but we'll go now and see a report.
I'm Dr. Sarah Muhammad Hassan. I'm a psychiatrist in mental illness in Ain Shams University. Post-traumatic disorder, it is a disorder that may start within 1 month of a traumatic event. Talk about the negative changes in thinking and memory. Feeling emotionally numb in any sad or even happy events that may happen to you. Difficulty in maintaining relationships between your friends or even your family members. Lack of interest in activities that you were enjoying in the past. Memory problems, that is hard for you to remind any happy or sad events. Negative thoughts about yourself. Hopelessness about the future. Finally, we are going to talk about the intensity of symptoms. Intensity of symptoms can vary over time. You may experience more symptoms, or you may come across things that makes you remember.
Welcome, Dr. Reem.
Thank you.
It's our pleasure to have you with us today.
It's my pleasure.
Let me start by asking you, can anyone get PTSD?
Okay, so basically, yes, anyone could get PSD at any age, at any time. It really depends on the incident that caused the PTSD. So to answer your question, yes, anyone could get it.
If the person avoids accidents, wars, and disaster, does this mean that he is less likely to get PTSD?
Less likely, yes, of course, because the examples you mentioned are one of the major traumatic incidents that cause PTSD, but there are others. For example, rarely only witnessing some traumatic scenes on TV could trigger PTSD in some people, so could lower the chances, yes, but not limit them at all.
Are there different types of PTSD?
Different types. What do you mean by different types of PTSD?
For example, if they have different symptoms, different types.
Okay. There is one type of PTSD because it's one disorder, post-traumatic stress disorder, but it could manifest in different ways in different individuals. So there are different symptoms. Some people might experience all of them. Some people might experience some of the symptoms. And of course, the severity might vary. So in that sense, yes, PTSD would show up in one case different than in another, but overall, it's only one type.
Okay. Can someone tell if he or she has PTSD?
Some of the symptoms are very evident, but I think if someone isn't aware or doesn't have the mental health awareness of some of the symptoms of PTSD, the ones that you mentioned in the beginning of the show, they might face trouble. But one of the most major symptoms of PTSD is avoidance. So if you find yourself, if you go through a traumatic experience and then you find yourself doing your best to avoid that place or anything that reminds you of that traumatic incident, then that's a hint that there's something going on. So avoidance is a symptom that might make people realize that in the beginning of a PTSD that they have it.
Okay, what is the PTSD treatment options?
Okay, so if the case is very severe, sometimes medication could be prescribed through a psychiatrist, but as a psychologist, I'm not allowed to prescribe medicines, of course. But for the talk therapy options, cognitive behavior therapy is one of the most known treatment now for PTSD, and there is another type of therapy, EMDR, which basically work with the eye movement. So it's the idea behind it is it's quite long for the scope of this show, but just so you know, EMDR and cognitive behavior therapy are one of the most commonly used therapies until now.
Thank you, Dr. Reem, for being with us today and giving this information. And now we'll be going on our report and come back to you. Stay with us.
Hi, my name is Marwan Mohammed and I'm suffering from post-traumatic disorder. It happened as a result from an accident happened on Saturday night. We were heading from the club at 11, me and my friends. And then on the highway, an old man decided to cross the road really fast. My friend didn't see him coming, so he struck him with his car. The scene with the old man hitting the window can't leave my memory. I always recall this day, it never leaves my memory. Pictures of this day usually pops in my mind with the scene of the guy hitting the window and smashing it and dying instantly. This scene can't leave my memory until now. I feel anger and an anxiety about what happened and sadness because of the man's children and of course regret. The steps I have taken, I went to a therapist to let me speak out and gave me medications and he helped me really good. You're welcome.
Welcome back, and thank you for being with us. And now we'll be telling you the 4 symptoms of PTSD. 1. Avoidance. 2. Alternations in cognition and mood. 3. Alterations in arousal and reactivity. And 4. Intrusion. Let me start by telling you the first symptom. Avoidance means avoiding reminders of the traumatic event. For instance, avoiding people, places, activities, or others. Alterations in cognition and mood, which means inability to remember important aspects of the traumatic event. And number 3, alterations in arousal and reactivity, means behaving recklessly or in a self-destructive way. And the 4th one, which is the intrusion, like intrusive thoughts such as repeated involuntary memories, distressing dreams, or flashbacks of the traumatic event. So we reached the end of our episode. Thank you for being with us.